Pain at the side of your hip that won't go away, or suffering with niggly groin or knee pain, then the muscle you need to pay extra attention to is the glute medius muscle. In this video, I'm going to briefly explain why it's such an important muscle for all lower body injuries, and myself and Lisa will clearly coach you all the exercises you need to both get rid of pain and also get back fully playing your sport. The glute medius is a broad, thick muscle, and it sits at the side of our hip, attaching our pelvis and hip bone, and it's a major source of pain around the outside of your hip. It can also contribute to you developing pain elsewhere because it's one of the most important muscles involved in helping us to walk and run and maintain control as we move. The primary role of the glute medius muscle is to stabilize us as we walk. So simple activities like taking stairs, balancing, running, and even maintaining our upright position all work the glute medius. It also brings our leg out to the side and is one of the main muscles that turns our leg outwards. So for sports people who need to run, sprint, twist, turn, and jump, a fully functioning glute medius muscle is of paramount importance. It has a huge role in injury prevention as it stops our leg from rolling inwards as we move, and without it functioning well, our pelvis can drop excessively, which puts extra stress and strain on the joints and muscles around our back, hip, knee, and even down to our ankle. If not functioning well, it can mean you have excess forces going through these other joints and they can get sore as a result. So strengthening your glute medius muscle can have a positive impact on the vast majority of lower limb injuries, and some of these middle stage exercises in this video, which are part of rehab, are often used by high level sports teams and athletes as part of their warm-ups for sport. What does it feel like? Pain around the outside of your hip, and as with any tendon injury, the exact sensation can change, and it might start with a dull ache or pain after movement or exercise, and then it can become more frequent if you ignore the symptoms. The pain can improve with a good warm-up and allow you to exercise, but it can get to the point of sharp pain that feels deep and doesn't go away. People often describe it as feeling deep into the hip joint. You can also develop pain along the front of your hip and into the groin. People can have hip pain in most activities, including walking. So what should you do? If possible, you need to reduce the aggravating activities, which might mean temporarily stopping running and sport, or at least reducing the intensity or frequency of your training. But resting completely isn't the answer. You need to strengthen the area. In this video, I've included simple exercise programs I'd recommend to help you get started when it's quite sore and sensitive, and progress onto the exercise intensity you need to fully return to play. Depending on your level of sensitivity, you might be able to start with the middle stage program. So these earlier stage exercises are very useful if you're quite sore, and it can seem a little bit counterintuitive to do something on the muscle when it's quite sore, but the purpose of this is actually to bring down the pain. So the first time you do it, you might feel it a little bit. That's actually fine. Try and get the technique right, do these exercises, and at the end of it, you should feel less pain, and I want you to feel the area working and having worked a little bit of fatigue, a little bit of tiredness. But what's more ideal is if you do feel it in the right areas. So that's going to be the focus on these videos that Lisa's going to demonstrate as we go here. So the first one is a single leg bridge exercise. So what we're going to do is hold this in nice and tight to avoid excessive movement or unnecessary movement through your back. You're putting downward intent through here and lifting your hip up 6 or 8 inches, holding it there for a few seconds and repeating it like that. Now the purpose of this is that as you go, you should feel muscle activity around this area. This is where you should feel it working. Have downward intent through here. With all of these exercises, you can do anything from 8 to 12 repetitions. Always stop with 2 reps in reserve. I'm not going to get too anal on the exact reps and sets. If you have any questions on that, you can post it in the comments. That's the single leg bridge exercise. So the next exercise we're going to do is the sideline clam exercise, and it's to bring a little bit of attention and activity to this area. So lying on your side, knees bent like this, keeping your heels in contact. Bring your top knee up while maintaining contact with your heels. Now what you might have to do is push it up an inch or 2 higher than you might think is okay, and you also might have to hold it up there for an extra second or 2. Again, the purpose of this as you do it is that you should feel muscle activity in around this area here. It's not going to happen instantly. But if after a set or 2 you're not getting that, the option is to actually change the position. So you can maybe have your legs a little bit straighter. Do whatever you need to do to try and feel it up around this area. You might have to bring your knees all the way up to there and do it there. Again, just making it clear that when you're doing this exercise, the purpose is that as you go, you should feel muscle activity around this area. So the straight leg raise exercise, again, its purpose is that you feel muscle activity around this area. So you're lying on your side, I would say having a slight bend in your knee. And if you can imagine trying to like straighten this down a little bit, so you're not lifting through your back, but lengthening your knee, lengthening your leg, slight bend in the knee, and then you're lifting this up. There's lots of little tweaks you can do to try and get you to feel it in this area. You might have to extend your heel even further, keep that bend in the knee. You might have to go an extra inch higher. You can hold it there for a few more seconds. As you bring it up, you can do some small little circles there. Whatever you need to do to start feeling muscle activity around this area. So stop with 2 reps in reserve, take a break, and repeat that. Single leg balance exercise. So again, we're working this side. So if you want to bring your knee up, stay nice and tall. So try and extend through there. Yeah. So in this position here, the purpose is that you feel this muscle starting to work. So you can hold it for anything from 5 to 20 seconds to get started with. It's the standing leg that's working. If you're unsure about balance or you feel unsafe, do it close to a wall. But as you go, maintaining upright posture, pushing through this foot, and you're going to start to feel this muscle working. So they're the early stage exercises. Like that, they can be used multiple times a day to help with pain. After a few days, you might need to take a day off, but the purpose of these is to get pain down so that you can move on to the next stage of exercises, which is what we're going to demonstrate now. So here we have some exercises where we put a band around your knees. That just makes the muscles around your hips work harder. This is the banded bridge exercise. So lying on your back, outward intent with your knees into the band. Now really try to burst the band, and then you're just lifting your hips up 6 or 8 inches. Hold it for maybe 3 to 5 seconds, and then dropping all the way down. As you go, just maintain this pressure. And again, the purpose of this as you go is that you do start to feel muscle activity here. Depending on the strength of your band, you might do 10 or 12 reps, take a break for 10 seconds, do that 3 or 4 times. Do it till you feel muscle activity there, and that'll be your set. The next exercise we're going to move straight on to is the banded rotations with squats. In this position here, we're going to start just down around here. Now what you're doing is bringing your knees in and out as far as you can. And again, you might have to change the angle that you're at. The purpose of all of this is that you get muscle activity around here. Once you do 10 or 12 of those, we're going to go straight into banded squats. So again, sitting as deep as you can with outward intent and outward pressure with your knees into the band. So if you do, again, another 10 or 12 reps and repeat that, this is all to get this area working a little bit more. The third exercise we're going to move on to are banded toe taps. So there's a little bit of getting the technique right in this one. So you're going to squat down, shift across to this side. So as you're looking at it here, shoulder, hip, knee, foot should be all in one line, and I want you to sit into your hip a little bit more. Starting then on your toe, what you're doing is tapping your toe out at about 45 degrees with all your weight on this side. Now, apply a little bit of extra intent with this knee out into the band. So that little inch or two movement there can make a big difference. Keep that pushed out throughout. It's going to be challenging enough to do that. And that should mean that you start to feel more muscle activity up around this hip area. You will also feel your quad a little bit, but the purpose is to get it up here. So keep the intent with this knee out into the band as much as possible. So the one arm dumbbell step up. So what you're going to do is have a dumbbell in one hand. This is the leg that we're working, and you're going to start with your hand inside your knee here. Now, as you're doing this, all of your intent is down through the laces. Really try and focus on pushing your foot down through the ground or through the box, whenever you're doing these exercises, and you're not pushing at all with this back foot. It's all through here. So downward intent through there, stand all the way up. Good, slow all the way down. All your intent through there, drive this hip forward as much as you can. Slowly on the way down, and as you go there, because of the position that you're in, it's going to bias the outside of your hip a little bit more. So as you go, you should feel a little bit more activity through the outside of this hip. From there, we're going to move on to the deficit reverse lunges. Just get a small box, starting with one foot on it, and your back knee is going to be about an inch or two behind. So we're going to start with the back knee right on the ground, right in here, okay? Both dumbbells are in beside the shin. Again, downward intent through here and stand up on the plates and then all the way down. So all your intent and drive is down through that foot and pushing that hip all the way forward. When you're starting off, 8 to 12 repetitions is a good gauge to work off. They are the middle stage exercises, which you can see listed on screen there again. You should start to feel better, stronger, more confident by doing those. But to get this fully sorted, it's better if you apply more stress through it. So we're going to move on to the last stage of exercises, which involves getting you closer to return to sport, lifting heavy and bringing in some plyometric exercises. So the final stage exercises for glute med rehabilitation involves actually lifting heavy things. So we're going to start with the deadlift here, just a conventional deadlift, trap bar deadlift. You can do it with a straight bar if you like. Feet about hip width apart. So you're going to grip it, take the slack out of the bar so you have tension through here, and then two things, pushing your feet into the ground and pushing your hips forward. So here's an opportunity to lift something heavy. If you're a beginner, start with your higher reps with a very manageable weight. But if you're able to at all, let's try and get as heavy as you can for about 4 reps. So it's really a different stress on the muscle. A way of advancing that or focusing a little bit more on the affected leg is to bring in the free stance deadlift. So if you want to just take a look at the feet here. So if we're working this leg here, you're going to start with this foot behind that foot. And then when you're doing this exercise, all your intent is down through the back foot. So let's take a look at it. Same setup as your deadlifts. Driving down to the left foot, driving the hip forward. And as you're doing that, you're definitely going to feel more stress and work coming through the left side. So maybe drop the weight from your max effort for a conventional deadlift, but that's a really good one to include as it biases one side more than the other. From that, we're going to move into our side lunges. So again, people returning to sport, you can't do everything in straight lines. This is our first time doing something like this, but this could be included in your earlier stage if you're able first. So what we're going to do is start with the dumbbells beside your waist here, and then as you move to the side, just getting both dumbbells down beside the knee. And pushing off, so have clear intent through this outside foot. So clearly in this side, we're working this hip here, step to the side and spring back in, but you would do this on both sides. Moving on to our last 2 exercises, plyometric exercises to work the hip a little bit more. We're going to go with our split jumps. So with this, trying to get maybe 20 repetitions in a set. Take full recovery time so you get to get your breath back before you move on to the last one, which is the side-to-side jumps. So just have a clear lateral step, sit into your hip a little bit more. You can bring your back foot across the other side just to make sure you're biasing that hip a little bit. So there's our final stage exercises, which again, you can see on screen. If you're doing that, it's a much higher load, so you're not going to do that every day. Like 3 days a week would be ideal. The middle stage exercises you might do as your warm-up before this gym session, and you would also use some of those banded exercises as your warm-up before running or playing sport. If you're stiff or achy and you're back playing sport, which absolutely can happen, as a means of bringing the pain down and recovering, you can also use those banded exercises from stage 2 at home to get rid of it. So don't wake up the next day and feel, oh geez, I feel that this isn't right. That's absolutely normal. As you get yourself back to where you were, you should feel it a little bit more. But at home, doing 10 minutes of, say, the banded toe taps, banded bridges and the banded squats, 2 rounds of that can mean you take the pain away and you feel better again. That's a normal part of recovery. If you have any questions on any of this, please feel free to comment below and we'll be happy to get back to you. Thanks.